What is the half-life of vancomycin? Have you ever wondered how long a medication stays in your body? Today, we are focusing on vancomycin, a medication often discussed in the context of inflammatory bowel disease. So, what is the half-life of vancomycin? The half-life of a drug is the time it takes for the concentration of that drug in the bloodstream to reduce by half. For vancomycin, this typically ranges from 4 to 6 hours in adults who have normal kidney function. This means that, after 4 to 6 hours, the amount of vancomycin in the blood is cut down by 50%. Now, how is vancomycin eliminated from the body? It is primarily removed and changed by the kidneys through a process called glomerular filtration. In fact, about 75% of the dose given is excreted in the urine within the first 24 hours. Because of this kidney clearance, the half-life can vary quite a bit based on kidney function. For those with severe kidney impairment, the half-life can extend dramatically. In some cases, it can take up to 7.5 days or even longer for the drug to be eliminated. This is important for patients who may have sensitive stomach conditions like irritable bowel syndrome or colitis. Speaking of sensitive stomachs, it is interesting to note that oral vancomycin is poorly absorbed into the bloodstream. This characteristic makes it especially useful for treating infections that are localized in the gut, such as Clostridioides difficile colitis. The limited absorption helps to keep systemic side effects low while still allowing the medication to work effectively in the intestines. For individuals dealing with inflammatory bowel disease or colitis, vancomycin can be a key player in treating or preventing infections that may worsen their symptoms. However, since the drug is cleared mainly through the kidneys, it is essential to monitor kidney function. This ensures that dosing and frequency can be adjusted if necessary, particularly for those with sensitive gastrointestinal conditions. In summary, the half-life of vancomycin in individuals with normal kidney function is typically 4 to 6 hours. In cases of severe kidney impairment, it can extend to several days. Vancomycin is mostly eliminated and changed by the kidneys and is poorly absorbed when taken orally, making it effective for gut infections. Monitoring kidney function is vital for safe and effective use, especially in patients with sensitive stomach issues.